So we're now going to have a Dementia Inclusive Communities panel, and I'm going to turn it over to Dr. Emer Begley, who has kindly offered to chair this session.
So our first speaker this morning is Fiona Foley, and Fiona is the National Co-ordinator of Dementia Understand Together in Communities. Now, a lot of you will know Fiona already. She's been working for a few years now on the campaign and is really progressing it, working with all the national partners across the country and the community champions on the ground as well. And Fiona not only is a fabulous colleague, she's also a true dementia champion herself. So we're delighted Fiona is here today, and she's going to talk to you about the national programme and the recent findings from an Omnibus survey of public attitudes to dementia. So I'll hand over to you, Fiona.
Thank you very much, Emer, for the warm welcome, and thank you to Engaging Dementia for having me today and also for having the session today. I really look forward to it and to the exchange. So what I'll do is I'm just going to quickly share my screen here. And as Emer had mentioned, I will talk about the Dementia Understand Together campaign as such. And I'm also going to talk about some research findings to see what impact has had the campaign on the lives of people with dementia and on knowledge and awareness of dementia in the communities. You might be already familiar with the Dementia Understand Together campaign. It is really one of the 6 priority action areas of the Irish Dementia Strategy, and it is there to create better awareness and understanding around dementia. Now, the campaign was created based on a lot of research, literature review, but also, and very importantly, on focus group and feedback from people with dementia and their carers. And what came out is that there is still a lot of, there was a lot of lack of knowledge of understanding about dementia in our communities and amongst the general public. And also that, you know, stigma is very much apparent in the communities. So the campaign set out to address that. And the objectives of the campaign are to create an Ireland that embraces and includes people living with dementia and which displays solidarity with them. And together with people with dementia and with their families, we looked at how can we do that? So we can do that by building better awareness and understanding, and also, and very importantly, by inspiring everybody in our community, individuals, businesses, service providers, to really take meaningful actions to support those with dementia. So you might have been aware that following that, and a big part of our campaign was a 2-year national TV and radio campaign. And it was really impactful because we had people with dementia, their families, talk for 2 years on TV about the impact of dementia and how they're living with dementia, and also how they're living well in their communities, and how important community support is. And it was a TV and radio campaign, and we measured the impact of this after 2 years after we started it. And we could see that there was a huge increase in knowledge and awareness when it came to dementia. But we also know that advertising can only do so much. So we felt that in order to really achieve meaningful change, and you can see some images here, meaningful change where people can be respected, supported, can continue with their hobbies, continue doing their own shopping, going into parks, all of these things, we need a real culture change for dementia in Ireland. And the only way we can achieve culture change is through people and through our behaviors. So the next part of the campaign focused on people and behaviors and changing those behaviors. And again, together with people with dementia, we looked at how can we address that. So it means that it's about the way we think about dementia, the way we act towards a person with dementia, and the way we interact. And sometimes that can be very difficult. So where do we start? So again, we try to break it down into very precise actions. And these are actions that we all can take. So I think the key about our campaign is that this is a collaborative approach. So we're working together with the Alzheimer's Society, with Age Friendly Ireland, with Healthy Ireland. So we're using those national networks to try and reach out into communities. But in addition to that, we also have approximately 40 national partner organizations. So they range from transport, retail, pharmacists, local community groups, and so on. And together with over 400 community champions. So these are, again, individuals like you and I who are taking actions in their communities. They really are inspiring others to get involved and to make a difference. So what does that entail? So sometimes that entails that, businesses will participate in training. They might, hold awareness talks, amongst their colleagues. They look at their premises to see if they're actually accessible for a person with dementia. And our community champions are rallying the troops out there. So they talk to local councils. They hold awareness sessions within the community to really see and change how we think about dementia here in Ireland. And again, we went out and we measured this. So in July of this year, we wanted to see what impact has had the campaign on the lives of people with dementia. And also, is there a change in understanding and attitude towards people with dementia? And the sample consisted of 1,217 interviews, which were all conducted face to face. And I think the first thing that we found is that, we're very aware all of the prevalence figures of dementia in Ireland. So there's 64,000 people living with dementia at the moment. I'm sure there's a vast number who are undiagnosed as well as that. And what struck us really is that 48% of those surveyed, they know at least one person with dementia. So we see that this is really very prevalent in our communities, whether yourself, you're affected, whether it's a family member, a friend, a colleague, people are very aware of people around them who have dementia. So that's an opportunity in itself as well to continue talking about it and rallying people to support others who are living with the condition. We also asked, what is the source of information? So where do people get their information about dementia? And it's really, again, very encouraging that word of mouth is a big source of information. So it's about, again, people who trust other people. And that's where they start having these conversations, talking about dementia and trying to get more information. So again, there's a huge opportunity within communities to link into those networks and spread the message and information about dementia. But what we also saw, and I think that is a very important shift, is that 41% get information from healthcare professionals. And that is up from 21% just 2 years ago. So that is really a huge increase of people turning to their healthcare professionals also as a first port of call when they feel that there might be, they might have dementia or they have questions around dementia. And that has a big impact on the model of care as well, and how that is implemented. But we also saw that there was a huge shift in increased knowledge about dementia. And, in the past, people would have been very familiar with, memory loss as a symptom of dementia or misplacing things regularly. But now we also see that other items, such as problems with physical movement, problems with language, the loss of interest of doing things, that is also a known symptom. And also all these things that you see in the green sections here, poor decreased judgment, feelings of disorientation, changes in personality. You can see that that's all up in the 80s. So 86%, 85% are aware that these are symptoms of dementia. So I think that whole message that, every person experiences dementia different, and there are very different and many different forms of dementia that bring about different symptoms, that message is coming across. But we also see that people see the importance of getting an early diagnosis, so that is good, so that people with dementia can have the opportunity to make decisions about their own care. Also because it helps a person to get the right help and support. But also, we've been starting a lot talking about risk factors and reducing the risk of getting dementia. And 84% of people felt that there are things that we can all do to improve brain health as well. So that again is a really insightful for us to see how are we going to continue communicating about that and communicating about the risk factors. What we also saw is that people felt that if they got a diagnosis of dementia, that they would still be able to have active social lives. So 63% of people said that. 37% felt that they could stay in paid employment. So that is something that can definitely be improved. But I wonder, you know, maybe 2 years ago, and this is the first time we actually asked this question, how many would have said it then? So I think it's really good for us to have that baseline now so that we can continue working on that and letting employers know that just because somebody has a diagnosis of dementia, it doesn't mean that they can't continue working. You know, again, with all of these things for a person to stay connected, we might have to support in some way and we might have to adapt things in some way, but that is possible, and it supports a person to have, you know, stay involved in their community, in their employment, and so on. But it wasn't all rosy. The survey. So we also still asked about the topic of stigma, and about 28% of people felt that they would not want friends and family to know that they have dementia, and 26% would feel embarrassed or ashamed, and 10%, and thankfully that number has decreased, but 10% still felt that they would give up on life. So there's a lot we can still do. And I think, again, it means also within our communities, the community support and showing that support is there is really vital. And that shows that. So we really have noticed that there is a change in perception and there is a greater empathy out there amongst the general public. And if you can see, if you just look at those increases, 12% increase, 11%, 9%, these are all significant increases. So it means most people in the community would treat a person with dementia just as they would treat anybody. Most people would accept a person with dementia as a close friend. So we can see that there's definite shift there into the positive, and it really shows that there's a greater empathy as well for people with dementia in the communities. Two things, and I saw Helen was on the call here today as well. So two things that we found really positive too was that Helen very often talks about active citizenship, and 92% of people surveyed felt that people with dementia have the right to be active citizens in their community. 81% felt that service providers and businesses can still do things to make their services more accessible for people with dementia. So I think, again, it is something when we're talking to our local businesses to discuss of how can they actually ensure that people with dementia can stay included. What are the things we can do, whether it's accessibility, whether it's the service, whether it's training, all of these things can still be improved, but the community support, the support from the population is there, the willingness to support is there, and I think that is really, really hopeful to see. So there's a huge evidence base as well that when there are local initiatives, that they very much help to create empathy. That's where people are touched. That's where people can understand dementia better. That's where they have communications about dementia. And that's where they can also see where they can get actively involved to support a person with dementia better. So if we do increase those local initiatives, that means that we have a greater chance to increase empathy and also to have real felt meaningful actions in our communities. So I know Emer hasn't come up yet, but I am going to come to my conclusions as well. And there's just a few things from our campaign side. And I know that you will be listening to a lot of the, of national initiative and also local initiatives later in the session. And I think it's really encouraging because we work really closely together. And I think with all of these initiatives, what's really important to always keep in mind is that the person with dementia and their families are at the heart of this. In order to have any meaningful change, they need to be included from the start. And I think we will see that in these initiatives, that's very much the case. It's also really important that we understand that every community is unique. We can't just say this is the way you're going to progress and this is what you're going to do to make your community inclusive. Every community is unique and it has opportunities there. So we can look at building on what is already available. Collaboration is really key. It's key for us, but it's also key, again, in the local community to link in with stakeholders that are involved there and who can support you so that we can really increase our reach, but also sustainability. You'll hear about some dementia alliances this afternoon. And again, if you form a Dementia Alliance, it just gives you the focus of specific projects that are very much focused on what is going to be helpful for people with dementia in your own community. And I think one big aspect is that we continue talking about dementia, but also talking about all the things that are happening, so that people with dementia are aware that they are happening, but also that we inspire more and more people to get involved and to take action. I've just put together a few websites here. You'll find them on our Dementia Understand Together website. You have a lot of resources, publications as well. I think one publication that's really important is the Hear Our Voice, Guidelines for Involving People with Dementia. But also you can Google the World Health Organization Toolkit for Dementia-Friendly Initiatives that we also fed into. And I think there's some very helpful tips in there as well. So thank you very much. And I really look forward to the session today.
Thanks so much, Fiona, and thanks for your comprehensive presentation, and you kept your time, which is wonderful. It's really interesting to hear the findings of the survey and where progress is being made, but also to shine a light maybe on where additional focus needs to be concentrated over the next while for the campaign. So thank you so much. If anybody has any questions for Fiona, pop them in the Q&A or the comment section, and Fiona is going to be coming back after the next set of speakers to join in a panel discussion, so do post your questions. Next up, we have a double-hander. We have Tom Gray and Helen Rochford Brennan. Tom Gray is a research fellow from TrinityHaus Research Center in Trinity College, and as an architect by training, but for many years he's been working in the age-friendly space and has published a lot on age-friendly design and dementia-inclusive design. We're delighted Tom could join us today. And Helen is going to join him. Helen Rochford Brennan, as you will all know, I am sure, no doubt. Helen is the former chair of the European Working Group for People with Dementia, and she's not only a national advocate for people with dementia, she's a global advocate for people with dementia. She's always an inspiring speaker, so we're delighted she could join us in this session today. Tom is going to tell us about the ISO standards for inclusive communities, and Helen will speak to opportunities development of the ISO standards from a personal perspective. I'll hand you over to Tom. Thanks so much.
Great stuff. Thanks, Emer. And I'm really happy I'm going before Helen, because she's a very hard act to follow. So I'm going to talk you through this ISO draft standard, which is around creating a framework for dementia inclusive communities. So very interesting, I suppose, from what Fiona talked about there, and the idea that every community is different and every community has its own set of requirements and challenges and so on. And I guess in many ways, this framework is a kind of a way of dealing with that. It's a kind of an open kind of process that provides the flexibility, but yet some kind of structure to help communities, work their way towards becoming more dementia inclusive. So our role on this was as the Dementia Inclusive Communities Committee. So we're part of an NSAI committee, and that was tasked with reviewing the standard, I guess, and giving feedback to the authors, and the main authors being the ISO drafting committee themselves. So that committee was composed of Elizabeth O'Farrell from the NSAI, Matteo Zalio from TU Dublin, myself, Pauline Boland from UL, Ruth O'Reilly from CUD, PJ White from IT Carlow, and Helen Kelly from UCC. And of course, we were greatly supported by the National Dementia Office, the Alzheimer's Society of Ireland, and also Age Friendly Ireland. So thank you for all the input. And I suppose that's where Helen's input specifically came as a key stakeholder, I suppose, but also her work with, her work with those organizations. So just to say, in terms of the ISO, I mean, we're talking about the International Organization for Standardization. It's an independent, non-governmental international organization formed all the way back in 1946. So there's now a membership of 165 national standards bodies. And there are currently 334 technical committees dealing with absolutely everything from zinc alloys through to assistive technologies. One of the committees that's named Aging Societies was formed pretty recently in 2017. And its task is to develop standards to address the societal needs of our aging population. But I suppose more importantly, to provide guidance to organizations that are dealing with services for this age group and for older people in general. So there's a number of priority areas that has been set out within this technical committee. The first one that we're talking about today is about being dementia inclusive. The second one is around aging workforce. Then there's health promotion and preventative care in older age, social connectedness, communities with multi-generational people, and carer inclusive. So a number of standards and initiatives and so on are developing within each one of these priority areas. But the standard or the framework that we're talking about today was obviously developed within the Dementia Inclusive, the priority, the first one. And I believe it's the first draft standard, or certainly one of the first draft standards to have emerged from this particular work. So in terms of our role and the committee that I showed a moment ago and the various organizations that were involved, we weren't initially authors, although we were brought in as to assist in some of the authoring and writing of the document in the second half of the project. But initially, our task was to review the document and conduct a number of sessions with stakeholders. And it happens in a number of different ways, and some standards receive a lot of deep engagement and others don't. Now, we're really fortunate and very lucky with this project and this feedback and this engagement to receive an awful lot of support. So we ended up having 4 online workshops and utilized what we call a co-design approach. And we hoped it was supportive and inclusive of all stakeholders. But the review resulted in a set of detailed and pretty comprehensive findings. In fact, I think Ireland provided the most feedback of any other country, to the point that that's when they asked us to come on and help out with drafting the document, because they saw there was such a grassroots approach here in Ireland, and they were very impressed, I think, by the organizations and the very informed feedback. I think, going back to the point that Fiona has made, that successive campaigns have probably raised people's awareness and knowledge and so on. So this is one of the other outcomes from that in many ways. So to give us a flavor of the kind of stakeholders, we had persons living with dementia, Helen being one of them and others. We had family members, we had carers, we had national representative organizations, we had occupational therapists, dietitians, all the way down to architects, engineers, researchers, academics, and so on. So really a very broad spectrum of stakeholders. But of course, throughout the process, it was really about keeping the person with dementia first and foremost, but also carers and family members. So there was some very lively debates and there was some really interesting kind of key subjects that arose, and Helen will talk about those again in a moment. But I think one of the ones that really stood out, and again, Helen really brought this to the table, was that any approach around dementia inclusive communities should first and foremost take a human rights approach. That the importance of language and terminology is really critical, particularly in a standard that's to be, international and to be understood by different cultures and countries and so on. That the point that additional support to enable continued engagement in daily activities and community life is really critical, and that we need to be enabling people to partake in decision making. Fiona also referred to risk. One of the things that came through from our stakeholders was that risk, first of all, it's an inherent part of life, but it's also an inherent part of living with dementia. But risk can be mitigated with adequate support and engagement with people. So that's, a project like this, a framework, really needs to embrace that idea and work to mitigate that risk while not trying to negate it. So a number of key themes arose with a lot of sub-themes, but just to highlight 5 kind of key themes that we really used to underpin our own process was, first and foremost, to always place the importance of obviously the person with dementia, but their families and carers and the supporting community. That's really critical. That respect, inclusion, and choice need to be there at all times in terms of a framework. Providing voice, advocacy, education, and communication really critical. And of course, back to the great work of the National Dementia Office and the campaigns. That people talked a lot about risk and prevention. Again, Fiona talking about that a couple of moments ago. That was an interesting theme that came through. But providing this supportive physical environment. Again, a lot of people talk about the accessibility and usability of the built environment and the community, and parks and spaces and houses. So these were some of the key themes that were really kind of jumping out. So a really quick overview of the new standard itself. Well, the scope says is the following, that the document involves a framework for dementia inclusive communities, including principles and the considerations for inclusion, quality of life, built environments, special needs groups, and stakeholder engagement. It also provides guidance on how to systematically leverage, improve, and interconnect existing assets and structures and help communities transform efficiently into a dementia inclusive community. I think it's really important to say that this standard does not provide any clinical standards. It's not about that. It's about the environment, it's about services, it's about supports and so on. We talked about language and we talked about terminology and some of the definitions that came through and I suppose were developed through the standard were interesting. And just grabbed two here just to, I think they're important definitions for the standard itself, but part of the broader conversation. So in the standard, they've defined dementia inclusive as providing an equal access to opportunities and resources for persons with dementia, including, but not limited to, a focus on stigma reduction, accessibility, individual tailored services, and participation. Then when they talk about a community, because a community can mean many different things to many different people, whether it's physical or online, pretty embracing in this way. But I'd have to say it's primarily defined as a place or a group of people with an arrangement of responsibilities, activities, and relationships. And that this place can be a location such as a city, a town, a neighborhood, a village, or a rural area. But it can, to be fair, also include a group of people with shared interests or features such as professional groups or religious organizations and so on. But you'll find with the standard that it is largely place-based and dealing with a community in terms of a town, a village, or a neighborhood or so on. So that's the kind of scale I think it effectively works at. There is a number of key parts to the actual document itself. It talks about process, how to go about developing a dementia inclusive community. It has a number of guiding principles which provide outcomes and enabling factors. It talks about how you achieve inclusion through an integrated community approach and really looking at this network, really pushes the idea of network throughout the framework. And then it provides a number of action areas in terms of community sectors that you need to look at, services, built environment, parks, public transport, and so on. So there's quite a few of those listed. Expected outcomes of the standard are obviously the improvement of quality of life for anyone with dementia, but also about development of quality services, ability to obtain recognition. This is an interesting one in terms of being able to call yourself a dementia inclusive community. Optimization of resources needed to develop inclusive communities, creation of new opportunities for all stakeholders, and more inclusive communities generally, where the participation of everybody, including persons with dementia, is facilitated and encouraged. And then the users of the standard, again, very broad. If you talk about a community, you're looking at a range of stakeholders. But to call out a few, we're talking about authorities having jurisdiction within a community, local authority and so on, organizations or congregations or community groups, individuals themselves, carers and families, very useful for them in terms of initiating action or making sure policy is going the right direction. Persons involved in education, research and development, decision makers, again, local authority, but also national government and local TDs and so on. So planners, designers and providers of products and services, such as the built environment, community infrastructures. So I mean, really, I would say everybody, but there's a wide spectrum of users there in terms of who we'd expect to be using the standard. So just to say, it is still at a draft stage. It goes out for further consultation, but it's a pretty stable document at this stage. And we've been told by the National Standards Authority of Ireland that it will be adopted by the NSAI. That does not happen with all standards. They're not obliged to adopt all ISO standards, but such as the support and importance of this document that it is being adopted. So that's fantastic to hear and see. So we'll keep you appraised, I guess, and informed about when the standard actually comes out, and we're very excited to see it actually being used. So I'm going to pass you on to Helen, who's going to, I think, give a better perspective from the point of view of her own personal experience, but also being a key stakeholder in the project. So thank you very much.
Thanks, Tom. Thank you so much. I'm just going to touch on a couple of things today. should we have a human rights approach to it? And I think we very much should have a human rights approach. But before I go on to talk about that, I would just like to say to everybody the importance of having these standards. But I want to go back to a few years with Emer, when Emer made sure that we kept the word inclusive alive and that we did have an inclusive society and belonged in the community, so we could belong in the community that we love and are loved in. And I think for me, that's really important to remember that we have an inclusive community. And I remember many words about would it be friendly? And my thing is friends come, friends go, but inclusion is there forever. So I was delighted to be part of the development of the standards because I was listened to. And that's really important for a person with dementia. Too often the voice of the person with dementia is left out and is overshadowed by other voices and the needs of care partners and supporters. So I was glad to be able to speak honestly and express my views. And at times, yes, we had robust conversations, Tom, but I was very moved by your willingness to listen. And it was just wonderful work. We had lively debates. And as Tom said, we did discuss language because language matters and it really matters for people with dementia. And I'm really pleased that the word burden was left out and that support was put in. Many of us were newly diagnosed, and thanks to the Understand Together campaign, more people are going to the doctors now and getting diagnosed. We require support. We don't always require care. So when we want to have support in our community, as opposed to being cared in our community. I love Tipperary where I live. I'm passionate about the power of the community. And as Fiona alluded to earlier, I have friends and family, and it's great to live here. But in my community, before I was diagnosed, I was Helen. The day before, the day after, believe it or not, I was the same Helen. So I'm not sure why I would be excluded from my community, and I give that a lot of thought. I'm misunderstood. I don't use the word stigma very much after all these years now. You can understand. I think the Understand Together campaign has made such an impression in this country, as you saw by the statistics, that honestly, we're nearly past stigma. We're just being misunderstood. And I'm sure if Kevin is listening to this, he will agree with me that, they misunderstand our illness. And that is a problem we have. So, we need our villages, our towns, and everything to be inclusive, to embrace us, and that we shouldn't be any different. We shouldn't be treated any differently, and that our rights should be upheld. Under the UN Convention of the Rights of People with Disabilities that Eleanor spoke about earlier, we have the right to access, and all we are asking for is that we are access and supported. And believe it or not, for the people with dementia, it is just mostly about an adjustment. And that is under the Act, So if we can have an adjustment that the post office and the bank and all our services that Fiona talked about, that everybody understands us. And if they have to make an adjustment to help us, that's fine. When I leave my keys, that somebody is trained on the till where I pay for my goods, to remember that they have a policy in place to get in touch with us. And there's simple things like that. Look, this was truly innovative work. And it was a new way of working. We had so many people involved, and I know there's lots of literature about standards, but it's a new way because we don't have international standards, and so by this important work, I suppose, it democratizes the knowledge and it makes it more accessible. Scientific literature is great, but it's not always easy to interpret. And that's important to remember. And the standards are also important because of increased awareness that Fiona talked about. And Emer, people are aware of the problems, they can fix them. But unless we make them aware, we're not going to. So yes, it's a rights-based approach, Tom, and very much so. We want guidelines that are implementable, and we want a framework and a toolkit. And I think those things are already out there, to be honest. I think, as I said from the beginning, the most important thing is that we have access to our community. And apart from having access to community, that we just ask for that minor adjustment. So the next thing I want to talk to you about is, I suppose, is a dementia inclusive community. Do we think it works towards a community that improves the quality of life for everyone? Well, of course it improves the quality of life. There's nothing more important than when we look back and we see COVID. We look back over the last year. Was the community important? Well, my community was extremely important because, as many of you know, not alone did I lose my husband, but I was faced with cocooning like everybody else. And but we needed a connection. Our memories might fade, but our words get mixed up, but we still need that human connection. We need to reach out to people. We need to be part of our communities. And being part of your community brings you great joy. And I know for me, that was the one thing that kept me going over the past year, was the joy of community. And we didn't use grand words like dementia inclusive or anything. We just choose the community, just who we are, just our neighbours, our friends. I think we're lucky in Ireland, and I'd love to see this made a truly international standard, because I think because we are so good at believing in our communities, that I honestly think it can work really, really well, and that we will come to a day soon, I hope, as we say internationally, that those words inclusive and friendly will be gone. I know the World Health Organization, some work I do, we often talk about that the days of having to have a label. Do you know, I have one label, and Tom, as you heard me say this before, I have one label, it's Alzheimer's, and that's enough for me. You know, I don't need anything else. So I think we can live extremely well. When you're diagnosed, of course you feel life will never be the same again. And if you're working, it's even worse. And today, many people, thankfully, are still working. So in some ways, you don't even think about how you're going to live. And you don't even think that, you know, it could be an achievable situation that you could live still in your community post-diagnosis. So yes, we had to go through a difficult time after my diagnosis, and it involved lots of worry and frustration and concern about the future. But then, as we have talked about a lot recently, we're resilient people. You know, we have to fight back. You know, we want people to understand that we're still who we are. We're still the same person. Yes, we have a memory impairment, and it shouldn't be a problem. It really shouldn't. You know, we are the same people. So it's a matter of just convincing people that, you know, nothing changes. I remember Sean meeting somebody once downtown. He said, I saw Helen, God, she looked great. I didn't know what to say to her. So Sean said to him, well, why didn't you say to Helen, hello, Helen, how are you? Have you any news? What's happening? She probably asked you, is there any new grants coming the way, you know? So, I mean, people they misunderstand us, and we just want people to understand that we can fully live in our communities. Yes, we won't be doing the same jobs we're doing, but I think these standards, from once these standards are set and from once they are implemented, and I hope they become a reality, I really do. And I'm delighted to hear that the NSA are going to adopt them. But I think it's important. The other thing I wanted to say about the standards is about, as you often hear me talk about, my social health. Well, my social health is really important because I like to get out and about. I like to enjoy my life. So because I have a diagnosis, that doesn't mean to say that I shouldn't be part of the outside world. And this is what many times we forget about, because there aren't standards there that can help us to understand, you know, that there's vital lifelines out there for us in our communities, and that we can reach out to them. And so if people want to play golf, if people want to do, you know, go to the theatre, go to a symphony, do whatever they did beforehand, continue to do all the things. You want to go down to the pub and have a few jars, go. You know, we should be supported, and all of the places that we go to should have an understanding and a training. And that is what it's about. It's about education and training. And I speak to children in schools, and I think we have to start there. I think it's really important that we continue the great work that's been done by the National Dementia Office in terms of education and training with the Alzheimer's Society of Ireland, because that's really important, that people are aware, and they're also aware of the different types of dementia. And that's important also because, you know, there's 100 or more types. So, you know, we have to think too about how if there's an issue in our community, that we can help, that we make our own contribution. Honestly, we can still go to clubs and organizations and apart from that, education and schools, we can still talk to other organizations and businesses and let them see and give them, as we say today, I'll give them my authentic voice. Kevin will give them his authentic voice. So we just want them to understand that, you know, whilst we still can, I'm not saying that it's going to be always like this, but whilst we still can, that we can contribute. But I also want to be sure that people that are at advanced stage, and I know them in my own community, and I know that I have often been asked, how can I help? And of course I tell shopkeepers, you know, when somebody, I remember only recently, somebody lost a car, you know, where were they? Well, you know, really and truly should have been driving a car, you know, was the other thing. So we have to be careful as well. And we have to, the most important word I want to leave you all with is, we have to be safe. And it's really important that we're safe. And I think with that, I can't think too much more other than we want to remember that this is about our human right. We had rights before we were diagnosed, and we have rights after. And I cannot keep saying it enough.
Thank you so much, Helen, and it's a great way to end your input there. We had hoped to have a little discussion with the three of you, but I think we need to keep moving. So if anybody wants to post any questions or comments, please do, and we can follow up with you afterwards. You can follow up directly with the speakers. I think the fact that there's so much to say on this issue is really telling, and we could have a whole session just having a discussion on language, I think, Helen, and on the whole issue of social health, I think, is so important as well, and how social life and being engaged and connected is really important to keeping people well, as well as all the clinical things as well. So just to thank the three of you for inputting into that session this morning, and I want to just give the rest of the 45 minutes or so to people on the ground who've prepared presentations on what they're doing around Dementia Inclusive Communities. So we have 5 short inputs, good practice examples if you like, and the first person up is Rizzo, and she's the lead for international relations from Age Friendly Ireland, and she's going to talk to us about the Walkability survey. So I'll hand over to you, Anne.
Thanks very much, Emer. I hope everybody can hear me okay, and I'm just going to share my screen with you all now. Age Friendly Ireland is a shared service of local government hosted by Meath County Council. The National Age Friendly Service supports cities, counties, towns, villages and rural communities across Ireland to prepare for the rapid ageing of our population. The population of Ireland is now over 5 million people, the highest it's been since before the famine in the mid-1800s. By 2046, the number of older people aged 65 and over will have risen to 1.4 million, and over 80s will reach 500,000 by the year 2046. General life expectancy will be 85.1 years for a man and 88.5 years for a woman. That means that for every 2 babies born this year in Ireland, one of them will live to be at least 100 years of age. By paying particular attention to the environmental, economic and social factors that influence the health and well-being of older people, we are best placed to influence national policy and be at the forefront in the delivery of initiatives and supports that will benefit older people as they age. At national level, the Age Friendly programme is supported by a strategic, cross-governmental national advisory group whose role it is to provide governance and oversight in relation to the national Age Friendly programme. So the journey has been long and sometimes difficult, but we've persevered. In 2009, the first Age Friendly programme was launched in Louth. Today, we have 31 programmes across the country, 1 in every local authority area. They say hard work reaps benefits, and our first 10 years of hard work was internationally acknowledged when in December of 2019, the World Health Organization conferred on Ireland the title of first age-friendly country in the world. This has identified us as an international leader when it comes to age-friendly practice and principles, and Age Friendly Ireland now engages with a host of other countries around the world, providing support and advice on setting up age-friendly programmes. The design of a community's built environment can often become the determining factor between a healthy and active lifestyle, or one characterised by limited mobility and high levels of social isolation. Physical changes that often accompany aging, such as poorer eyesight and hearing, and reduced mobility, can pose risks for older people when they're out and about in their community. In areas where the built environment is adapted, such as through the provision of safe footpaths, older people can be supported to be more physically active and to make more regular use of the public spaces, services, and facilities provided. Town structures should cater for all people. Age-Friendly Ireland believes that if you design for older people, you will, in the main, design for all. And it has pioneered the Walkability audit tool to capture the experiences of people using their own towns. Collaboration with the Centre for Excellence in Universal Design at the National Disability Authority has led to an even greater understanding of how towns cater to a range of people with differing abilities and needs. People with visual impairments, mobility issues, young children, as well as older people will be invited to participate in a town's walkability audit. Consultation is at the heart of the Age-Friendly programme, and listening to the voice of older people is key to the programme's success. Through engagement with the groups of older people, their voice is heard, and through this, a greater understanding of the issues facing them can be found. The information generated through the conducting of a walkability audit is very useful in informing town planners' understanding of what works well, and also in surfacing the issues and barriers that people face in their towns. The walkability audit is a practical, low-cost method of engaging local people with their town structures. It can provide very useful information on where changes can be made to increase a town's accessibility. So what is the definition of a walkability study? A walkability study or audit is the assessing and enhancing of the quality and continuity of pavements, the number, safety, and timing of pedestrian crossings, and any barriers to mobility in the street. A walkability audit involves a group of people getting together and walking a short, planned route of between 800 metres and 1 kilometre in order to assess it for how easy or difficult it is to walk that way. Walkability audits are a great way of understanding how a town works for older people and how it could be improved. People assess things like how easy it is to cross the road, if the footpaths are level, if there is any street furniture blocking the way, and what the bus stops are like. It is recommended that older people with a mixture of abilities walk the route, some who find it easy to walk, others who for various reasons find it more difficult to navigate. Getting started. So choose someone to act as a walkability coordinator and a couple of people who will support them. The walkability coordinator's job is to plan the walkability audit, get people to take part, and prepare the results. Select one or more routes which you think will have the greatest impact on the most people in the community, such as busy pedestrian routes. The routes should contain key amenities and services that older people use and visit regularly. So things like pharmacies or shopping areas, community centres, the local church, transport links, the post office, and focus on any area with a high population of older people. Once you've chosen the route or routes which make the most sense for your town, create a simple map of the route for those taking part in the audit. Choose a date and time that reflects older people's usage of the route. So for example, most people collect their pensions on a Friday. So maybe a Friday would be a good idea to do the walkability audit on that day. It's important to choose 7 to 10 local people with a range of abilities in each group you're putting forward for the day's activity. On the day of the walkability audit, it's important to be prepared. So have group leaders, note takers, photographers identified ahead of time. And prior to going out, begin with giving the group a short presentation covering an overview of the project, the process being undertaken, and the guidelines for the audit itself. So the walkability audit should take between 30 and 60 minutes to complete, depending on the length of the route and the mobility of the participants. It will be the leader's job to highlight potential issues and the note taker will record the comments from people as they walk. They can also prompt the participants to share their views whilst walking. Then back at the location at the venue, each group can discuss the walk with the leader, prompting discussion and recording of their views. And while completing the audit, you should look at what people have told you. Depending on the numbers participating, you might decide to carry out a simple pen and paper evaluation of the process, or you may use an analytical tool like SurveyMonkey or something similar that will give you kind of a pre-prepared evaluation and report. Get people that took photographs to send them to you, use those photographs, quotes, and qualitative and quantitative data in your audit. The report will inform key staff from within the local authority on areas that would benefit from alterations and improvements. And one thing I would say is, if at all possible, invite them to also take part in the walkability audit itself. They're going to be an invaluable resource to you, and letting them see firsthand the problems that occur for people when they're trying to navigate their local town can really inform them when it comes to looking at the improvements that they can make. So if a walkability audit is properly conducted and the results implemented, it will help guide us towards a more inclusive society where everyone's needs are considered, and the world around us will be a better place in which to age positively. Thank you.
So that was really interesting. It's a real practical insight into the walkability audit, and I love that idea of, you know, inclusive design caters for everyone. So thank you so much. What's really nice now is actually we have an example of a walkability survey in action, and Fiona Crotty, who's the program manager from Tipperary Age Friendly Program, she's a program manager and coordinator there, and she's also involved in the Ballina Killaloe Dementia Cafe, and she's a member of the Irish Dementia Cafe Network. Is going to talk to us about what they're doing in Tipperary and focus on the walkability survey in particular. So I'll hand you over to Fiona now.
Thanks very much, Emer, and thanks for the opportunity to participate today as well. So my name is Fiona Crotty, and I work at Tipperary County Council in the Community and Social Inclusion Unit. Just to point out, obviously very proud Tipperary person that we are the 6th largest inland county. 62% of our population live in rural areas. We have 2 community health organisations within the county, which has its benefits and disadvantages. But as well, we have over 3,500 people living, diagnosed and living with dementia in Tipperary. So just as Emer outlined there, we are on the journey of, I suppose, commenced our community engagement to increase awareness of dementia within the county. We received funding to Healthy Ireland, which was endorsed by our LCDC. The original intention was to focus on 3 towns, which were evolved due to the COVID restrictions to online training, and that evolved to all county to deliver online training and engagement. So the original focus was to provide a focus and engagement with business, community and sporting and volunteering community groups. We delivered the Learn, Listen, Link training was delivered by the Alzheimer's Society. We targeted at each municipal district within the county to try and break down the geographical areas of the county to build communities of interest and to build people that were engaged in areas in an online capacity where in the absence of being able to meet in a face-to-face setting. We also held a workshop with our own county councillors. This was attended also by the Alzheimer's Society of Ireland, by Fiona Foley from the National to Stand Together, and by Kevin Quaid. And I must say, in particular, compliments to Kevin. The councillors in particular really resonated with his journey as a lived experience, and it really, I suppose, resonated with the councillors the importance of the impacts of the project that we are undertaking that we can make within our own communities. So our journey has commenced following on from the Learn, Listen, Link training. We have conducted a walkability audit just recently in Roscrea on the 1st and 2nd of September, and we will have a further one in Clonmel on the 8th and 9th of November. So again, due to restrictions, the numbers of these have been reduced, but we will showcase the findings of those results in October in Roscrea. And our intention not only is to showcase them to our Alliance membership and for those who participated, but also to showcase them in a vacant premises on the main street in the town, and to showcase the findings of that walkability audit, and to replicate that also in Clonmel following the audit that will be conducted there. Staff of Tipperary County Council, which will include both the technical and also administrative staff, will be also trained in undertaking future walkability audits. The purpose for both, including both the technical and the administrative, is in terms of maybe potential grant applications in future to ensure that components will be undertaken in future grant applications. As you can see on the photograph there, it demonstrates a town meeting which we planned actually for next week is one of them. So this meeting is where we're inviting in specific towns following those that engaged in the Learn, Listen, Link training in Clonmel, in Nina, Roscrea and Thurles, to participate in those town meetings, so that those town meetings will look at how we can, at a local level, create that awareness, increase awareness, and encourage people within our communities to participate in training delivered by the Alzheimer's Society. And as I mentioned, we will follow that with pop-up shops in each of those towns to create that town within the town centre location. And I'm also hoping that we will be able to support with the dementia mobile unit as well on the day, and maybe do some health checks, have the dementia advisor present, have the social worker, so to have people present to support at the drop-ins. The Alzheimer's Society of Ireland are also supporting staff within Tipperary Museum and cultural staff within our arts centres with the Azure training. Also working with the Alzheimer's Society of Ireland to deliver inclusion training. And I think it was mentioned there in terms of that inclusion, that it's wider than dementia. So again, our focus is dementia awareness is one element. We have somebody going to talk on LGBT awareness, on disability, on the non-Irish community, and also on age-friendly and on ageism. So again, they will focus on those 4 towns initially, and that will roll out from there. And we also plan within that process of those 4 towns to provide further Learn, Listen, Link training with community and the business principals in those 4 towns. The Dementia Cafe Network, we're very proud to be part and parcel of the Dementia Cafe Network in the country, in the county. So I've been asked to be part of some of the new cafes we've commenced in Nina, and one in Ballina and Killaloe, and we will also start one in Clonmel, and to support and reinvigorate, I suppose, older cafes post-COVID in Roscrea and Thurles. Both of those have been extremely active for a number of years with amazing champions. So my role is really just trying to help coordinate and facilitate, provide supports and information to support that. So complementing actions, and I suppose I really want to stress the importance of the partnerships and how the partnerships will make and support any of our actions. So we have completed some recent recordings where we have recorded the Dementia Advisor, the Memory Technology Library, and the Living Well with Dementia service, and all of those supports. They will all are showcased on our website. We showcase them on World Alzheimer's Day, and we'll also showcase them. And we're producing a booklet that will be circulated to all of the GPs, public health nurses in the county. We launched on International Older Persons Day a reminiscence project back in my day, and we're calling it Volume 1 because it's something we hope to continue and progress in the future. We also have an intergenerational project ongoing between nursing homes and preschools. We have a Healthy Food Made Easy, 2 specific programs that are targeting those in the residential setting and externally with Healthy Food Made Easy. And we also, with Ursula there in Thurles, working with our digital connections and that provision of supports to older adults, but in Ursula to supporting people with dementia. And we were also working on creating a website on information of supports, supported by Silver Arch Community Family Resource Center. And that website will be a showcase of information supports in the county, and also looking at a sensory garden showcased in those 4 towns, but ultimately create a guide that we can ask all Tidy Towns groups and nursing homes to do within the county. So that's literally a whistle-stop tour of, I suppose, how through the partnership in the community that we are in Tipperary are on the journey for increasing that dementia awareness. But it is very much a partnership approach within the county. So
thanks so much, Fiona. And that was really fantastic to see the scale of the work you're doing down there. And I think with partnership, a lot can be achieved in a short space of time as well. So you're doing tremendous work in Tipperary, and thanks so much for your concise presentation, bringing it all together. Next up, we have Lianne McAree Murphy, who's the Health Promotion Officer with Irish Men's Sheds Association. And Lianne is going to talk to us about your shed and dementia manual, which was published earlier this year. So thanks, Lianne. I'll hand it over to you.
Yeah, so I suppose I just want to start by thanking you for the invitation to speak today at the conference. We have developed your Shed and Dementia Manual over the past sort of year, I would say. The Irish Men's Sheds Association, our mission is to sort of improve and maintain, or help men to improve and maintain their health by participating in communities and participating in their men's sheds. So men's sheds exist in communities all over the country, and they're fantastic spaces. They're open to all men, and they promote support, friendship, and routine. So there's about 450 men's sheds in the country pre-pandemic, and we hope this will be again post-pandemic, but there was about 10 to 12,000 men visiting a shed every week. And a majority of these men, while it's open to all men of all ages, a majority are sort of 65 plus. So the topic of dementia is something that comes up quite a bit. So I suppose the idea of the Your Shed and Dementia Manual came around from our work on the Sheds for Life program, which is community-based health promotion program that is delivered in the sheds. But the program, it's been developed by the Irish Men's Sheds Association with the partnership of Waterford IT and Killaloe IT. But it's also a very holistic program that engages the men in designing the program and what they would like to see. So through the Sheds for Life program, dementia is a topic that's sort of been raised by shed members and shed committees as something that they would like more advice and support on. Some sheds prior to this already had members who were living with dementia. So it was a topic that we felt warranted more sort of a bit more time and effort to sort of make sure that everybody who could get, so that people could get more out of the sheds if they were living with dementia. So we've developed this Your Shed and Dementia Manual. So I suppose in starting this project, we looked to the Australian Men's Sheds Association, who a number of years ago, they were very proactive and they already developed Dementia in Your Shed, a Dementia in Your Shed manual with the support of the Alzheimer's Australia Society. So to begin with our manual, we linked in with Fiona Foley from the Dementia Understand Together campaign and also members from the Alzheimer's Society of Ireland. So our first step was to speak to them, get their advice, and make sure that we were approaching it from an inclusive point of view. And then our next step was to sit down with some of the sheds and shed members and shed support volunteers to develop a manual that will work in the Irish context and the Irish sheds. So for sort of about 6 months last year, we worked really closely with the shed support volunteers and also the Alzheimer's Society and the Understand Together campaign to make sure that the manual was accessible and covered a range of topics and would also be really accessible and use appropriate language that everybody could use it in the shed, no matter what the context. So the manual includes really practical ideas and advice on supporting people with dementia in the shed. It has communication tips, listening hints. It has information to raise awareness of the condition for the men. But there's also information for shed committees on how to support shedders living with dementia in the shed, and also if they want to welcome people who are living with dementia in the shed. And there's also a piece on looking out for men who are carers. So it's a project that it's come together with an awful lot of collaboration from the experts in Dementia Understand Together and the Alzheimer's Society, but also from the men themselves. The project isn't probably something that would exist without the men, and them really raising the topic and wanting to learn more about it and how they support themselves, how they support family members living with it, and how to support friends and colleagues that are in the shed with them. So as part of the program, we sort of looked to the men and we got some of the men's testimony. And I think, to me, these quotes are really valuable and really important in terms of this is why a dementia manual exists. And it also highlights the strength of people living with dementia, the fact that they are whole people who bring an awful lot. So one of the quotes is, there was a shed in Kilbeggan who are really fantastic and have a man who's living with dementia. So their opinion was, I thought this man would benefit greatly and we benefit too. He's bonus, he's plus, he's teaching us, and we're benefiting from his presence the same way that he's benefiting from ours. So the Dementia Manual has really sort of brought all that together and would hopefully be a resource for all the sheds in the country. We've recently printed the manual with the support of the Dementia Understand Together team. So it means that a physical copy will be able to go to all the sheds in the country. So they'll get to read it, they'll get to share it, committees will be able to use it. It'll mean that more men living with dementia can come into the space, but it also means that carers can have support, and just, I suppose, it's raising the awareness of what dementia is, what dementia isn't, and how we can make our society more inclusive for everybody. The other thing about the sheds is that all the sheds are unique. So while all sheds have the potential to have welcome people from the shed, so all the sheds are unique, and while men are welcome who are living with dementia, I suppose my advice for anybody who's living with dementia would be to give the shed a call, to give the Irish Men's Sheds Association a call, and sort of have that conversation about whether that shed is the right fit for a man. Some of them are very work-orientated spaces, so they may not be the most safe place for them, but having those conversations and getting more people involved if they have the interest in the shed.
Thanks so much, Lianne. And I think it's a really good example of inclusivity in action, where it's an existing community asset or community resource that's adapting to be inclusive of existing members that develop dementia, but also a place where people with dementia are welcome to go to. So it's a really lovely resource as well for those of you who haven't seen it. I'd encourage you to go online and have a look. And I think it's going to be a template as an example for other organisations to adapt to become dementia inclusive. So thanks so much, and thanks for all your work on that and for preparing the presentation. Next up we have Lisa Farley. Lisa is an occupational therapist in the Memory Technology Resource Room in Wexford and Waterford, and really important topic around assistive technology and digital inclusion, and she's going to talk to us about digital support for people living with dementia. So I'll hand you over to Lisa.
So I'm an occupational therapist in the Memory Technology Resource Room working in Wexford and Waterford, and I'm also a member of the Wexford Dementia Alliance group. So today I'm going to talk about digital supports for people living with dementia. So people are living with dementia, not suffering from dementia. So this is really important. And I think throughout today and yesterday, this has really come to the forefront. A lot of people that have been speaking about the unique person with dementia. So they're not suffering from dementia. It's really important that the care that we provide is person-centered, that we show dignity and respect to the person, and they always consent to the care. So that, I suppose that's really important when we're looking at digital and assistive technology devices as well. So I work in the Memory Technology Resource Room, and I'm based in Waterford and Wexford. So the MTR supports the person with memory difficulties or carers with information on devices and strategies that promote independence, safety and quality of life. And then as an OT, we provide advice on simple and practical strategies, meaningful activities, environment, sensory and behavioural challenges. So basically there's an MTR in a lot of the counties now. If you want information on it, you can contact the National Dementia Office. They have a list and contact details. A lot of my colleagues really want referrals in, and we're very eager to see people with dementia and also memory loss and their families and try and assist them. Thank you. So the types of assistive technology. So there's a number of different types of assistive technology available, telecare, orientation aids, communication, leisure and reminiscence, sensory stimulation. So the main ones today that I'm going to focus on, because we're on different time limits, is communication devices and telecare and orientation aids. So what are the benefits of assistive technology? So there are a number of benefits of assistive technology. Some of them are to support independence. So it's made to make sure that the person can live at home independently and support themselves. So it might be something like they're just forgetting where their keys are. So this could be a simple device that they could attach to their keys to find where their keys are. It also can reduce caregiver stress. So the caregiver might be stressed and they might not be able to sleep at night. If there's a sensor alarm in the room or a bed sensor, this might assist the carer to get a good night's sleep. Facilitate memory recall is another thing that's a benefit of assistive technology, and manage potential risks. So for example, if there is a risk that the person might leave the cooker on, we could potentially do a sign and laminate it and put down, turn off the cooker. And also a stove alarm might assist them to remember to turn off the cooker. Also, the benefits of assistive technology is to improve quality of life for the person. So communication. Communication can be an area of difficulty for people with dementia. So dementia can affect a person's comprehension and language production. Often they might find it difficult to come up with the word that they need, but they might be able to describe it in other ways, draw a picture or describe it around the item that they need to. When you're coming in to visit somebody with dementia, it's really important to introduce yourself. Often when people come in to me, they might say, oh, sure, I don't need to introduce myself to mom. She knows I'm her daughter. But it might be difficult for the person to remember your name and you're putting them under stress. So just say, hi, Mary, it's Lisa here. Reduce or eliminate background noise when you're talking to the person. As it's discussed before, somebody was talking about sensory difficulties. So when there's noise in the background, this can really make it difficult for the person to hear and also to communicate. When we're communicating with people, it's important to use short, clear and concise sentences. Okay, so some of the communication aids that we would look at in the Memory Technology Resource Room includes the 3 following ones that I have up. We're trying to make sure that the person can be independent in communication. It's really an important thing. Communication is for socialization, it's keeping us connected. You know, there's a lot of important things that the person can communicate. Say, for example, if they're in a difficult situation, an emergency situation, that they can ring somebody. The first picture is of a landline phone and has pictures. So if the person is finding it difficult to remember numbers, they can press the picture of the person, which should be a familiar picture that they understand. The next thing is a cordless phone. It's quite similar to the other one. You can put in pictures and you can put in symbols. And the last is a Doro simple mobile phone. So a lot of people coming into me would identify that they're finding their phone quite difficult to use. And this phone, you can put in 3 different identified people. So there's no numbers on it. It just has the 3 identified numbers, and you press A, B, C to get through to the number. There's an SOS button at the back. This can be deactivated if it's not appropriate. And also some of the Dora phones have a GPS tracker on them. So tablet devices, this is another method of communication. So there's a number of tablet devices available in Ireland. And some of the devices are easy to use. They have technical support offered, designed and personalized for the individual. It's very important before purchasing a tablet device that you really consider and you sit down with the person and think about, has the person used a computer or internet or tablet device before? Will they require training in how to use it? Is there initial setup? Will this be difficult for them? Is there technical support available, and the screen size? So does the person have visual difficulties? Also, is it easy to charge? Sometimes if a person has dexterity issues, they will find it difficult to charge, but some of the tablet devices have pods where you put it in to charge. The next thing to remember is, can the person communicate using this device? So can they use it for calls, video calls, or emails? And then finally, the price per month. So I am part of the Wexford Dementia Alliance group. This alliance has enabled people working around the country from all sectors to connect with the aim of supporting people with dementia. So some of the sectors are the Guards, the HSE, voluntary organisations, the County Council. That's just to name a few. You have family carers and the person themselves with dementia. The Alliance in Wexford created a positive partnership that enabled the provision of the technology to people who needed it during COVID, which obviously is really important, because identified in some of the other presentations is COVID presented isolation issues for people, you know, and they were disconnected from loved ones, they were cocooning. It was a difficult time. They were disconnected from their community. So the Wexford Tablet Project was sponsored by Wexford County Council. It involved 3 tablet devices for 9 months, provided to 3 different families during the COVID lockdown. Training was provided for myself and the MTR on 2 different occasions for each family, and then the families gave feedback. The results of this is, as a result, there's 2 different families have decided to keep on the tablet devices, which is brilliant. During the COVID lockdown, also this group met virtually and created dementia services in Wexford leaflet and promoted projects for people living with dementia. Could I just say a big thank you to everybody involved in the Wexford Dementia Alliance? It really has given me insight into what inclusivity in the community means. Thank you very much. And then the next slide, please. Okay, so the feedback, this is the most important part. During COVID, my first grandchild was born, but I was unable to see her due to cocooning. I had my tablet and was able to see her video call daily. I never used the internet before, then got the tablet. I used my tablet to see mass every week. Next slide, please. Okay, so these are just some examples of telecare devices. A dependent alarm would be very familiar to people. GPS watches. When you're considering GPS, it's really important that you get consent from the person. Chair bed sensors, we kind of discussed them briefly, flood detectors and movement sensors. And then examples of home safety devices. So you have your key box locks. This box could be really helpful for, say, somebody that has home help and they don't want to give the key to everybody. You can change the code on the key box and it can be put outside your door rather than putting it under a plant, which a lot of Irish people like to do. And then you have your lockable plug cover, your countdown timer and your magic plug. I really like this. If you're having a problem with the person is leaving taps on, you can put this in and it just releases the water slowly. And lastly, the stove alarm. Then the orientation devices, they're for people that are having difficulty recalling the date or the time, different types of clocks. The last one there on your right-hand side, you can see it has white writing on a black background. It's an Android clock called the Rosebud, and you can also put reminders on it as well for the person. Thank you very much for listening.
Thanks so much, Lisa. And I know you could have done with a lot more time talk about a lot more devices, but you give us a really good tour of ones that are available. And just to say, Lisa is part of a network of memory technology resource rooms that are around the country. There's 30 MTRRs now, and you can go in and talk to an OT like Lisa, and they'll give you advice on assistive technology. So Lisa, you might pop in the link into the chat for the MTRRs when you get a chance. That would be great. And Lianne has already popped in the link to the Men's Dead manual. So there for anybody who wants to have a look at it. I've been told my sound quality is terrible, so apologies everybody, and I hope you can make out what I'm trying to say. But our last set of speakers are another memory technology resource room connection, Eilish Cahalan, who is the project lead for the MTRRs nationally, and she's joined by her colleague Dolores, and they're going to talk to us about the Tralee Dementia Friendly Initiative. So I'll hand you over to Eilish and Dolores. Are you there?
Good afternoon, and thanks very much for inviting us to share the Tralee story on Dementia Friendly Tralee. And thanks to the previous speakers, they've been really enriching and informative, and lots of ideas for us to take. So well done to all. My name is Dolores McAlligot. I'm a community worker in the HSE for the last 20 odd years. So a key element of my work is working with community groups and working with the community and voluntary sector. And I suppose best part of my remit, I cover the Tralee area. Just to give people a context, Tralee is the capital of County Kerry. It's a busy tourist trade. It has a population of about 24,000, 8th largest town in Ireland, with approximately 3,500 people over the age of 65. And the estimate prevalence rate of dementia in Kerry is about 2,500. So that's just the context. Back in 2019, I suppose a lot of our work has been interagency, intercollaborative working. So interagency work isn't new to us, but I suppose the whole conversation and question around dementia and how can we make our town more dementia friendly was a topic that evolved in lots of different sectors. And I suppose that was really because one of the reasons as I said earlier, we're a tourist town, and it's the gateway to lots of activities in the county. You recall there's what was pre-COVID, the Rose of Tralee, a lot of influx of visitors into the town. So a real willingness to ensure that the town was meeting the needs of its community and its visitors. One of our first conversations initiated with the Tralee Chamber Alliance around how could we work to support each other and to create an awareness around the dementia. And I suppose we were very cognizant, and Fiona, you said it earlier, just around the dementia strategy. That was one of the key objectives of creating an awareness, and it was everyone's responsibility. So back in 2019, we organised a breakfast awareness training programme, and the facilitator was recommended through very kindly by Fiona in the Understand Together office. So we organised training that we would do create an awareness among core businesses in Tralee. And to be honest with you, we had a little subcommittee initiated at the time, and the demand was just amazing. We held it, I suppose we were very clear that this needed to be community focused and needed to engage the businesses. So we held the training in the Bank of Ireland meeting room in 8 in the morning until 10. And I suppose that was one of the lessons, and I can just share a little bit about that later. But from that training, we organised in an interagency group in the town to look at it. That included ourselves and the HSE, the Chamber, Kerry County Council, the Garda Síochána, and I think they were really a key element to them. I think the whole awareness training had was really pertinent to them. Kerry GA, the ASI, the educational sectors. We have a third level sector in a third level education in our town, voluntary agencies, the Department of Social Protection, the local development company, and some of the older person services, along with families that were affected directly by dementia. So we had that representation from that as well. So I suppose, look, I'm not going to go in detail to what our terms of reference was, but if I were to mention it in a very clear sentence, it was about us working together collaboratively to create an environment that supported people with dementia, and actually an environment that created an environment that supported people with lots of issues. So we wanted to create an inclusive community, and very cognizant that it needed to be community-led, and the feedback really and the engagement was really good. Following that, we organised further training, and I suppose we did certainly part of our training in May of 2019, which I spoke about, was held in the morning for the bank in the local bank. That certainly we did evaluation of that, and we wanted to learn, was this working? So it was, the training was ideal, the time was ideal, but we needed to be aware, and we got this very fruitful feedback from businesses, was it needed to meet their demands too, and 2 hours out of a business to partake in training was could be challenging. So we worked with the trainer around delivering 1 hour session training, and in just pre-COVID we delivered 3 hours, 3 1-hour sessions of training around dementia awareness, and we had over 100 people participating with, I'd say, 50 businesses. I think it would be fair to say that there would probably have been 50 businesses in that. And really, it was a kind of whistle-stop tour, but I would say to anyone that are thinking of working around doing training with businesses, please consult with businesses. Our training is about as much as some people can allow to get people out for training. One of the other initiatives that I suppose was a huge success for us was the developing a dementia-friendly community information card that was around giving people tips and signs of dementia, tips on signs of dementia, communication, how they could stay connected, and then I suppose specific supports that were available in Kerry. And we did that locally, but we were very cognizant that it needed to be user-friendly. So we worked with NALA in ensuring that it was designed correctly, read correctly, written directly, so that it could meet those. And at the time, the Assistant National Director of Services for Older People nationally, Michael Fitzgerald, launched that, and it was just a little pocket wallet, that we circulated. I think there was about 5,000 cards that we circulated throughout the whole Tralee community and in businesses. And some of you probably in your own areas have local magazines and local media magazines, and they were inserted to all of those for 3 weeks in a row. So that worked really well, and we really got the message out there. So maybe Eilish, you might come on and take the rest of the elements.
Sorry, beg your pardon. Thanks. Hi, everyone. I'm very conscious of time, so I'm just going to whiz through this at the end. And the next slide there is just a picture there of the launch of the car that Dolores was just talking about. So another one of the initiatives was the Kingdom Dementia Cafe. And like many other dementia cafes throughout the country, this was set up, I suppose, in kind of conjunction with the Tralee Dementia Friendly Group. And it's facilitated by Catherine Murphy, the occupational therapist in the Memory Technology Resource Room here in Tralee, and in kind of collaboration with dementia advisors and with other members of the Tralee Dementia Friendly Group. It was set up actually in times of COVID, so since December 2020, it's been running virtually. But despite those obstacles and challenges, it's been running very successfully. I suppose it's like other cafes, it gives people an opportunity to chat openly and in good company, albeit online. And I suppose one of the things that we have in our Dementia Cafe is that we have regular slots where there's a regular exercise, 10-minute or 15-minute exercise slot that people really enjoy. And there's a regular mental stimulation activities that people enjoy. And then there's a regular slot by an Azure-trained member of our Tralee Dementia Friendly Group. She works in the Kerry County Museum, and she does a regular kind of reminiscent slots using some of the artifacts in the museum. And this has proved very, very popular. So again, sharing lots of ideas of different things that happen in the different cafes is important. And we're part of the National Dementia Cafe network as well. So that's ongoing, and we would hope, obviously, very soon to be facilitating that cafe face to face. So then in May, just this year gone, we organised further training. So we did organised some inclusive design training, and I was organising for the Memory Technology Resource Group nationally, and so we organised some training for our Tralee Dementia Friendly Group as well, because again there's great interest from businesses in terms of how do they make their environment dementia friendly and inclusive really for everyone. And again, this has been referenced obviously a lot in the different presentations today. So that training took place with DDS Architect, then proved very popular and great feedback from that. But one of the requests was a specific, could we have the top 10 tips when we are looking at our environment as to how, where do we start from? And we're very aware that there was obviously already a Dementia Inclusive Design Guidance booklet, kind of collaboration with DDS Architects and the National Dementia Office. But we said we'd just create kind of a smaller, really snapshot, easy to use, easy to pick up for business to walk around their environment to use. So recently we just developed sort of a dementia-friendly community Tralee top tips for an inclusive design. And this is just kind of a very small leaflet that has kind of tips and things as seating, accessible bathrooms, signage, floors. So all the main inclusive design areas, but just kind of the top tips on each of those. Obviously someone who needs more information if they're looking at their environment, they'll probably have to kind of go into it a bit deeper, but this kind of booklet starts them off and gets the conversation going. And again, we just kind of did an official launch of the booklet there in September, again coinciding with the National, I suppose, World Alzheimer's Week.
I just want to say thank you to all the speakers this morning. It's fantastic to see what's happening internationally, nationally, and what's happening in communities across the country. It's very inspiring and it's heartening. And the main message I'm coming away with is that, if it's dementia inclusive, it's inclusive for all. So thanks so much.